start with this. I want you to see this pie here, and some of you may have seen this before. Some of you may have never seen this pie chart out here, but this is actually pulled from a few years ago. But it's still very, very relevant to the market that you're about to get into in healthcare. Some of you may be in healthcare already. Matter of fact, if you don't mind, we don't have a poll or anything, but if you're paying attention here and you can type something in the question box, why don't you tell me that either yes, that you're in healthcare, or no, you're not in healthcare, or you've never been in healthcare whatsoever, if you've been a little bit. So it's just a yes or no. So if you'll just type in yes, I've been in healthcare a little bit, somewhat, or no, I've never been in healthcare at all. That's all I'm looking for, a yes or no answer there. So let's see what we got here. Okay, we've got a few folks that said yes. Saeed is yes. Peter, no. Ahmad, yes. Hassan, no. Got a couple other no's there, some yeses. Okay, so we got about half and half, some people that have been in it. And, you know, being in healthcare, you can be really in, gosh, you know, many different aspects, you know, whether it's you're a doctor, maybe you're a clinician, maybe to just be a phlebotomist. That's the person that kind of draws the blood when we go get our lab work done. Maybe a medical assistant. You may have actually helped people in billing. Maybe you've done credentialing. But this whole world, folks, about the medical financial world is ever growing. And I'm going to show you some statistics here in just a moment. But you can see here how big healthcare is in its fullness of this industry. There are truly physicians and services spending. You can see there's $614 billion annually. That's a lot. You're talking 600,000. You know, I mean, that's a lot of money. Let me just put it that way. I can't even count that high. However, what I want to do is point out a couple of things here on this pie chart. You can see that the biggest piece of this chart here is 32% residing in the hospitals. Now, as medical billers, as we are, that's not really a world that we're going to be in. Now, there are some billing that you can do for hospitals, but we're not going to be worried about that. We're going to be dealing with the physicians in the clinical. That's 20% of that $614 billion annually, and it's actually increasing with that number, as you can see there. There's a lot of things you're going to be able to do with the physicians in the clinics, and we're going to kind of go through some of those different services, some of those different service silos, as we like to kind of call them here at ABS, that we're going to show you where you can be making money, whether you're doing billing or whether you're doing some of these other services. So if you kind of come today wanting to really kind of know some of the ins and outs of some of the other services, we're actually going to talk about that. I got some folks here that says we've done some hospital billing, others, some manufacturers, maybe your wife has done some things in there. So again, it's good mixture today. All right, so one of the questions I want to answer though here is this. We get asked this quite often. But what about dental billing? Does American business systems, do they do dental billing? Well, I want you to see how much of the spending annually is actually a percentage over here in this pie chart. You can see that 4% of that is dental billing. So let's kind of put that to rest here. I know that we've got a competitor out there that's kind of touts that maybe ABS doesn't do dental billing, so you probably want to go with them because they can offer medical billing, maybe even some hospital billing, which is very complicated. I'll tell you that. I wouldn't want to tackle that by myself. You'd have to have a big company to do some hospital billing. But then the other thing is about, well, ABS maybe doesn't offer dental billing. Now, we do have some dental billing possibilities, some services that you could do there, but you can see that's such a small slice of the pie there. So what we're trying to do is put you right smack dab in the middle, where if you put it like we would like to say, we're going to put you in the middle of the river where the money flow is streaming here. So that's why we're doing medical billing with doctors, with clinics. There's the biggest part of the money. There's where you're going to get the biggest bang for your buck here. So that's what we want to kind of make clear here while we're talking about this pie chart here. There's some other things that have come out as of last year. Now, you know, a lot of these studies, they're always a year behind. So you can see this back in 2019. You think, oh gosh, that's old numbers here. Well, you got to realize that 2020 isn't over yet. So we can pull these numbers. What we have here is obviously from 2019. And here's some a little bit newer numbers. So you can see, again, these numbers adding up pretty much the same, but look at the years down here. We started at 2011, and now you can see where we are in 2020. So we're right smack dab in the middle of this chart. But you can see here, right smack dab in 2020 down there, this is where it's going to have the biggest curve of money being flowed through here. So again, you can see there for 2019, the top U.S. healthcare expenses, again, by categories, 32% of that was hospital care, kind of similar to what we saw in the pie chart there. 26 of that was professional care services. 20% is physicians. So you've got almost now 40 something percent, 46.6% there that where you can actually go for some more of that money there in healthcare. And again, 3.7% is dentists. So again, but you can see where it's going by 2027. This is huge numbers, folks. So if you're looking at any type of business opportunity that you're looking out there, and comparing that to whether you want to open up a restaurant, whether you want to open up maybe a cleaning service, some of these other franchise opportunities out there. Again, we're not a franchise, we're a business opportunity. You want to look where the growth is. And so obviously, this is the growth, this is where it's going. You can see these numbers for Medicare and Medicaid services at CMS. Folks, this is the industry where you're going to want to be. So hopefully we've kind of got you a little bit excited here. This is some pretty big numbers here as we're kind of going through this. All right. One other thing we want to talk with you about is, before we actually kind of get into the meat of everything here, is the Entrepreneur magazine. They put out several startup books. Start your own, in this one, medical claims billing service, or you can start up your own healthcare business, or maybe a stock brokerage or something like that. They pick out some pretty decent ones. Maybe start your own real estate business. They do have these step-by-step guides to kind of get you kick-started there. Folks, you can go find this book out there on Amazon. I think it maybe runs 20, 30 bucks. Might be something good for you to go pick up if you're interested in getting into medical billing. It's a small investment. Now, folks, we don't make any money out of this. That's all Entrepreneur magazine. However, again, we're pulling out some of the information that they say is where the market is. So you can see 5.8% is growing even through 2024. So that's another 4 years off. I just showed you back over here, the growth that you're seeing is all it's going to do is escalate. So kind of going back over here to the Entrepreneur magazine book here, this little step-by-step guide, they're still saying it's going to increase, and you can see the numbers here. So again, you're going to want to be a part of something that's going to keep growing, no slowdowns. It'll be good for recessions. It's good through pandemics. You know, we here at American Business Systems are always moving and shaking for whatever's going on out there in the marketplace, especially in the medical billing world. We're always looking for new services to add in to help our licensees and help our new medical billing companies get launched off the ground and get that first thing that you want to get, which is a new client. That's the biggest thing that we want to help you work with. So, folks, you can see that there is a lot of things that out there that you can look and research and find out where the growth is. And obviously, you can see that one of them is in medical billing. All right, so we're going to tackle 3 questions today. The reason we're going to look at these 3 questions here, because when we've looked over some of our questions that we get through our webinars, these are some of those questions that kind of keep coming up, and we want to review those systematically this afternoon. So the 3 questions is, why will a doctor even want to outsource to me? So we're gonna dive into that question. We're going to answer some of those questions. Then we're going to talk about what will I do to earn a living. So you're going to see some of the things that you're going to do to earn the living while you're doing medical billing. So we're going to talk about that. And then finally, really, it's maybe some of the things that maybe drove you to this webinar today is, you know, really how much can I earn here? Because what it is at the end of the day, we know that what you're looking for is a return on your investment. If you're not looking for a return on your investment right now with any business, I would tell you stop what you're doing and figure out how you're going to make your money back. Patrick and I in the past have taken our investment, which is 28,000 or so, just under $30,000 here. And what would it take for you to get that $30,000 back into your pocket with the investment that you made, and how quickly can it be made back into that? We also know that $30,000 is just not something you have laying around here either. We don't want you to lose that money. So we want you to make sure that you know what you're going to do to help earn that, get it back, and get it back as quickly as possible. And you're going to find out that typically, folks, whenever you're starting any new business, whether it's a small business, a medium business, or a large business, everybody's looking for a return on investment. So also, you pretty much know that in normal cases, to get your return on investment is usually about 1.5 to 2 years if you're really hustling and out there, okay? So when you're out there 2, 3 years on some of these other businesses, you might get your return on investment. We've actually shown you that you can get a return on investment here by just doing business for one doctor. That's going to earn you anywhere from $35,000 to $50,000 a year in return with one doctor. So imagine just securing one doctor. That's why we stress on just the most important thing for you is getting that first client and start their billing and get that return on investment with that one client, so that when you add your next doctor to this, which could be a month or so down the road after you start a doctor, now you can think about, man, I'm already going to see myself, in the black and not in the red, so we're going to see ourselves getting that return on investment pretty quickly. So again, be patient with me. I'm kind of monitoring the question box here. I want to make sure that I get everybody's questions asked, and we're going to talk about the different things here. So one question that was asked on one of the previous slides was, what was the professional services? Professional services is going to be, again, in healthcare. So it could be working with a clinic and maybe taking over some of the billing for the clinic. There could be, Hassan, some of the services that are specifically for those professional services. It could be some of the coding aspect of it. It could be some of the going after some of the old money about that. So there's a lot of different things here that you'll see here through the presentation that can actually help out those medical professional services as we kind of go through this. And even in the near future, we're going to show you some of the other services that we're bringing on here that are actually going to even help out even much further. So first of all, let's talk about, why would a doctor even use you? I mean, can you imagine you're going to a doctor's office, and listen, I've been there. I'm a licensee myself. I've gone out there and looked for doctors myself, and doing that to make sure what we're teaching and what we're putting out there actually works. And so, and I know that it works. And you can talk to some of our other licensees, and you're going to hear from one next week that's going to share with you how she was able to get her doctors. But again, why would a doctor even want to outsource to me? So that's a great question that you should be asking, because, comes along with that, there's another question. Doesn't the doctor already have medical billers? Well, you're going to find out that typically, the people that work in that front office, like you see here, are not necessarily the billers. Those folks are people that check you in at the doctor's office. Matter of fact, I just got through seeing a doctor this afternoon. The people that I saw there behind the glass there, as you can see that, those people weren't doing billing. What they were doing, they were checking people in, and they had another little station where we were checking people out. So these people are not necessarily billers. Sometimes the billers are in that doctor's office. Sometimes they are not in that doctor's office. Sometimes that they've already outsourced to somebody else. So yes, I'm going to tell you right now, right off the bat, the doctors are already doing billing. I promise you. If they're not, they're going to be out of business in 2 days. So someone's doing the billing. And so it's a great question to ask, doesn't the doctor already have billers? And the question of that is, you've got to understand that is yes. So why would a doctor ever want to change? So let's look at that here real quick. So one of the things we're going to teach you how to do here at American Business Systems is to do what's called a practice analysis. Now, this is somewhat a sketch of a practice analysis. It's kind of a filtered down type of a practice analysis The one that we have is very professional and it's very detailed. But if you're just kind of scratching the surface here, you just kind of need to know what are the comparisons. So you got to know that the cost of a full-time employee, some of you might know that as an FTE, so it's a full-time employee, is going to run at a minimum about $15 per hour. That's a decent wage for someone that works in the doctor's office in-house. Okay, they're doing 100 claims per week. Again, just like what we've kind of got illustrated out here in the outsourcing part of it. You can see there, if you were just doing the billing for that doctor, you'd be charging about 6% over 52 weeks. You'd be making about $31,000 a year. So remember, whenever I mentioned to you earlier, trying to get that return on investment, see, we're under 30,000 already. This is a very low. I mean, we're talking about 100 claims a week. I mean, that's nothing. Sometimes the doctor will go, they'll reach 100 claims a week in 2.5 days. So they can be twice that in most cases. So you've got $31,000. There's your return on investment right there. So imagine that would be yours. You've already got that over one period of your time, and you got your ROI back in 1 year. However, kind of let's get back over here to the lane here. I'm talking about in-house versus outsourcing. Okay, so we've got 1.5, because I'm going to tell you, it's not always just one person doing the billing, it's multiple people doing the billing. So right there, in just the wages that the doctor has, is going to have just under 50,000, if not at right about $50,000 in just labor costs alone. In labor costs, that's nobody, there's no return on that except for what you see there. Then you got payroll taxes on that, workers' comp, errors and omissions, insurance, the training costs that they have throughout the year, maybe for some continuing ed, and some leave coverage. So maybe you got to bring in a temporary person for a little bit. Whether you have that in there or not, it really doesn't make that big of an impact. And some employee packages, benefit packages. Then you got your hardware, your software, and your IT. You couple all of that up there, you're at about $65,000 compared to the $31,000 that the doctor would be paying you. Now, let me ask you, if you were having the same work done, you've got this over here, you got medical claims over here, and you got medical claims over here. You got your outsourcing, that if you outsource it versus you have it in-house, and you look at this, and it's going to cost you about 48% more money to do the same thing out over here if you just outsourced it. What would you do? I mean, think of it. So don't let this frighten you that, when we go back one slide here, don't let this frighten you that the doctor may already have a biller. It's okay. We want to know that they've got a biller, because what we want to be able to do is be able to get in there and do this cost analysis. You're going to find out this cost analysis is the key to help you win your clientele. So just keep that in mind as we kind of go through that. Okay, so let me see if I've got any questions. How much have I to invest in marketing? Okay, so Tinsy is asking, sorry if I didn't say your name correctly. You're already getting marketing material from American Business Systems. There may be a little bit of expenses on some other things that you might want to do. So you might want to think about reserving a little bit for marketing, but again, you got to know that after you've invested your money into yourself through American Business Systems, the biggest investment that you're going to make out there after that, after you've done your training and all, is going to be the time. It's just going to take time for you to get out there and get to know some doctors, let some doctors get to know you. It's going to take a little bit of time. So it's not so much how much money you're going to be spending out on marketing, it's how much time you're going to be investing in marketing. So hopefully that's a little bit better. Let's see. It seems to me that the majority of the offices, this is from Saeed, the majority of offices who uses newer software seem to already have an integrated software that does the billing for them. Okay, so for those that may, I'm going to try to break down this question. So there's not a software out there that the doctor just puts the information in. Okay, let's take it back to me. I went to the doctor today, got my little checkup today, and that doctor made his notes, and he turns that in, which is somewhat called a super bill, and then he's going to hand that off to somebody. Okay, so they're not going to just be able to get it and then put that super bill in there and poof, out comes a claim. gets pushed out there. Somebody has to do something with it. So yes, there's a lot of new integrated software out there, but not as integrated as the one that we have here at ABS. Now, I'm not going to be able to show you the demonstration of the software today because I want to go through the numbers, but you're going to find out if you call back, work with the person that asked you to come to the webinar today, ask them to show you a demo. That's what's going to show you the separator, the difference between what you do as an ABS business owner, utilizing the software, what I claim and EMRX, the integration that's there. I'm telling you, you're not going to find anything out there on the market. So hopefully that'll be able to help you. Let's see. Someone says they're not seeing slides. Let me ask this. So let me say, let me ask either Adam or Nevin. Are y'all seeing my slides? Just give me a yes or no in there. Someone said they couldn't.
Yes, I can see your slides, Eric. Yep.
Okay. Thank you, sir. I appreciate it. All right. So Hassan's asking, how can you interact and offer your services to doctors while he's always pretty busy? Great question there, Hassan. We're going to answer that to you. And one way we're going to do it is doctors are not happy about all the rejected claims that they're getting. So doctors are busy people. So we've got very strategic ways of getting you in front of the doctor. I'm not sure if I've got it in this presentation today, but you may have seen it. We've got a book out there that's going to help you get in front of that doctor. I promise you. Now, I think it's in our last Wednesday's webinar that if you need to see that, but we're going to show you how that actually works. And I've got a copy of that book here. Towards the end, I may pull it out. But doctors are faced with claims that are rejected. Matter of fact, the market analysis estimates that about 24 cents out of every dollar are wasted on administrative and billing expenses. Now, we didn't make that number up. That came from the New England Journal of Medicine here. So, folks, we've done our homework. We've done our research, and especially whenever it comes down to claims that are rejected. Now, here's a key, and here's a little element that I want you to make sure that you write down. Typically, where the doctors lose most of their money is in rejected claims. And you're going to see here in this article that was written by Dave Jackalow, who says why doctors should outsource their billing. And he says this, you can see it, I've got it bolded down here. It's not unusual to have a 35% or higher rejected claim rate. Now, what does that mean? Well, that means that if you've got 10 claims that go out, almost 4 of those claims, 35% of that, I mean, you just think about that, because, you know, about 4 of those claims are going to get rejected. Now, I don't know about you, but if I pay $1, I want to make sure that I get the value of the dollar. I don't want to pay $1 and get only 60 cents out of that dollar. And that's basically what's happening. So you can imagine losing up to 30 to 35, maybe even 40% of your money just because claims are rejected. And the problem with that is once those claims come back rejected, let's say that, you know, here's the claim, it goes out, comes back, and that claim gets rejected because something wasn't circled on that sheet there. It could just be a small little error like that. And then this claim gets back to a biller that may be very busy at that doctor's office, and that goes over to a stack of piles of going rejected claims. The problem that we find here is that getting back to those rejected claims are not always expedient as you think that they might be. So that's why we can start seeing help with you on getting in front of the doctor and showing them how we can reduce that 30-35% rejected rate, where we are, and we're pretty good at the number, we're pretty proud of that number. It's anywhere from 2, maybe as high as 3%. So imagine taking that gap there from 35 down to 2, maybe 3%. But we're pretty much about 2% rejection rate. So imagine instead of getting paid about 60% of your money, you're getting paid about 98% of your money. Now that will turn a doctor's head, especially when you do, again, this practice analysis. Because now what we're going to do, once we're in front of that doctor, we've been engaged with them, we're going to simply say, Doc, hey, I'd like to present you and help you do what's called practice analysis. There's no cost, there's no obligation to you for doing a practice analysis. And so what we're going to do there is take that we're going to take their numbers. So we know that there's industry numbers out there. We could pull all those industry numbers and kind of give a ballpark figure for what's in it for the doctor. But at the end of the day, why not just use his numbers or her numbers, and let's just kind of put their numbers in this practice analysis questionnaire. And that's what we do. We're going to teach you how to do that. So we're showing you how we get you in front of the doctors, what you're going to do when you get in front of those doctors, and answer the question, why would a doctor even outsource to you? Why would they even gamble on changing? Well, whenever you can start to see some numbers like this. So let's take a look at this. This is an actual one that, because you can see we got everything redacted here. Here's a practice analysis report or practice revenue report. So this particular doctor's office did about 1,850 claims per month. It was actually 2 doctors. So, that's about 900 claims a month. Then you see the average amount of claims that were per claim. So it came out to be about $105 per claim. Now, you've seen us do these numbers. We've talked about an average claim being about $100. Now, this was taken back in 2013. That number's actually gone up from now, but again, you can kind of see where we're going with this. The licensee got the approximate rejection rate, which was about 18%. You put that number in there. And it starts to calculate. The monthly calculated, the current outsourced percentage of what they're doing a little bit there, their cost of their salary, the cost of their IT, their software, and all of that. And at the end of the month, they're getting $150,000 a month. You go, that's not too bad. I'd take $150,000 a month. But you go down a little bit further. Here's where our project is. So we put our number in there, about 2%. We're even going to include what's going to cost the doctor to do the service there. You can see it $12,945 a month to actually do the outsourcing. Still with that, the doctor's going to make money. And so you're going to go from $150,000 a month to $177,000 a month. That's a 17% increase. That's another $26,000 more a month. This is why a doctor would even consider outsourcing to you. That's another $321,000 a year. That's how we do it, folks. We're not going to send you out and go out here and come. We're not going to say, hey, come join us here at American Business Systems. We've got the best training in the world. We're going to tell you how to go out there and say, doctor, use me because I've got the best software in the world. We're not going to tell you to do that. We do have the best software in the world. However, what we're going to do is show you exactly how to go out there and really communicate with those doctors. And what better way can you can communicate than with their own money. Folks, that is $321,000 that doctor is losing right now. So put it in those terms. This is why a doctor would go, I think I'd like to listen to you a little bit more. That's why we're going to tell you at that point, the next thing you're going to do is get and invite that doctor to do a demonstration of the software so that one of us here at our staff can actually show that doctor how we're going to get to those numbers. Okay, so folks, we've been talking everything about the doctor, their numbers. We're going to start switching gears here. What do you got to do to make this living? So we're going to talk with you right now about what are you going to have to do. So let's get on to some of this. So, and again, I'm kind of monitoring the questions here. And some of these I'm going to answer towards the end because I don't want to, we're already down at the bottom of the hour and I've got a lot of content I want to try to get to. So what are you going to do to earn this living? First of all, you got to understand that it also has in it its own baked-in EMR system. So we have our EMR X that's already built into the system. So those two are going to communicate all the time. So there's no integration. We don't have to pull something from one program that may be a Microsoft-based type program. Not knocking Microsoft too terribly much, but you know, it's what it is. So. But everything's gone to the cloud, folks. It's all software as a service now. So everything that we have out there, I mean, even Microsoft Word is online now, and Excel and PowerPoint, all of that's out there online. So again, all of ours is a cloud-based system. It's called a software as a service. But the key point I want to show you here is, and if you're not familiar with billing already, I'm going to give you a little bit of education here as well. You can't just go out there and buy medical billing software and then just start spitting out claims and getting them out there. You got to have a portal in which it goes from your system eventually to like Blue Cross Blue Shield or Medicare or whatever else. What you have to have in between you and that insurance company is what's called a clearinghouse. That'll give you the portal between your software and those insurance companies. The great thing about it is you don't have to worry about working with a third-party clearinghouse. Ours is, again, already baked in. We have our own. So that way, we're only dealing with our claims. We're not having to deal with other people's claims from another mom and pop shop somewhere else. Everything that runs through iClaim is our own clearinghouse. It's not being bombarded by anybody else. That's a key component there, because that's where we keep those rejection rates down to less than 2%. We're getting doctors paid back in 7 to 14 days, so less than 2 weeks now. So these are big things here. So imagine giving the doctor about 25 to 30% more money every month in a quicker amount of time. I mean, again, who wouldn't want that? And then finally, we've got our own patient portal. So the patient portal, especially now in the COVID area, and this we already had this prior pre-COVID, our patient portal already comes in with a built-in telehealth system. So our telehealth system is already inside of our system. We've already been doing telehealth before it was cool, so to say. So we've got this patient portal, our EMRX, everything's working together. So imagine having your telehealth visit with your doctor, the doctor's working the EMRX, you as a patient, you're signing in through the portal, and then all of a sudden, the billing, whenever the doctor gets seeing you, it already goes into the iClaim for you to go ahead and process. So here we've got a doctor over here that just got through seeing their patient, and they're using EMRX, and they're going to send that over, and it automatically comes to you as an American Business Systems licensee. So all of that's on your computer. He's in the cloud. They're using an internet service. You're over here. You're in the cloud. You're using an internet service. It's just all matched up in the middle. So no longer do you have to have this super bill as you see here in the middle. The doctor sees the patient. You get the claim. So let's kind of break down some of these. Oh, okay. Here's where I wanted to illustrate to you that, again, the doctor is using our EMRX system. It's all tied in. It's all one system, because if I were to click right here where it says EHR, that would get me into the EMRX system. So you got EMRX, you got iClaim, our clearinghouse is here. So the doctor sees his patient. When he wraps up that visit, just like today, when I went to the doctor, if they were using this particular system, as soon as he walked out the door, he types out a few more notes, he hits submit, and that is already gone to the biller. It would have gone already to the biller. And now you as the biller, you have it, you can process those claims. You can see now, instead of it leaving this billing system going to a third-party clearinghouse, it's going directly now to an insurance company. That's how we get the doctors paid within 7 to 14 days, and actually, again, keep that percentage rate to less than 2% down, as you can see here. So let's kind of step through this. I want to kind of give you a little illustration. This is a little demo right here, so you can kind of see how this is going to work. So we're going to do the billing. So we're going to go over here to billing, click on billing. From there, we're going to click on professional claim charges, and that's going to enter us right here. So imagine we got that piece of paper that said super bill on it, and it's got these numbers. So it's got the ICD-10s, that's the diagnosis codes, and then it's got the procedure codes, so that's what the doctor did for us. So all we would do is type in those numbers. So right down here, you see in that little square box number 1, we've got an R05. Well, that would represent a call right there. Once we got that plugged in, if that was all that we needed, then we're going to move on over to the dates of service, and then what's called the procedure code. So here we would put in the dates, obviously the procedure codes, which is a 99213. That was a regular office visit. Again, you don't have to worry about the codes because the codes are already built in there. So don't worry too much about medical coding, because we've got you covered both ways, both inside the system. And then if the doctor says, hey, do you do medical coding? You can say yes, because we've got code right for you to be able to do that. So either way, remember, you're a medical billing revenue cycle management company. So you're just not having to be stuck with being just a coder or just a biller. You're watching that doctor's revenue all along. So that's why we've got the resources, the code right there for you. If the doctor says, hey, I need for you to do coding for me, great, we can handle that, not a problem. All right, so the codes come to you. You're going to input those in there. It's going to kick out the fees, because the fees are already built in there, because those are going to be based off of Medicare numbers. So we've got that already built in there. Once you get through that, you're going to come down here at the last part. We would figure out what would be scrolling down. We would click on create claim. Once we click on create claim, boom, that claim's out. It's gone through the clearinghouse, and it's going to be within the health insurance platforms within 24 hours. So imagine getting that kind of turnaround out on claims. Most doctors have never heard that ever before. All right, so we've got a little bit about less than 20 minutes here to kind of answer this big question. So, okay, how much can I actually earn in medical revenue management? So that's what we're going to tackle right here. We're going to take 2 or 3 scenarios, and then I'm going to go back to your questions. I kind of paused my questions because I don't want to get too lost and too bogged down too quickly, but I want to get through this information, what time we have left over. We maybe going to spend a little bit of time right at the end of the hour or at the top of the hour and pick up some more questions here. So again, the big question here is basically, again, how much can I earn? Because I know I need to get that return on an investment, but I also want to make this a family business, or I want to create a business where I can hire some other people. Maybe I got some friends that lost their job during the COVID seasons and all of this, and who knows if we don't go through another type of thing like that. It would be nice to be able to work for yourself and maybe even expand it out further to where, hey, man, I'm actually helping other people as well. So the big question, how much can I earn in medical management? All right, so one place you can go here is you can see what is the ROI of your ROI potential. Go to our website, go right here, and it says income potential, and then you're going to go to medical billing income calculator. So we're going to click on that. We've already got some numbers here. So we're going to, again, take one doctor. Remember, our goal with you is to help you get that first doctor, that one doctor, because after that, everything starts coming along because of the other marketing you've got going on. All of a sudden, that next doctor is right behind that first doctor. So we're going to take one doctor that sees on average number of patients per day of about 25 patients a day. Now, what we're looking at here is not any specialties. We're talking about a regular PCP doctor. That would be your primary care physician. That's what we're looking at right here. So you got one doctor that sees about 25 patients a day, open 5 days a week. You're going to charge about 6%. Now, a lot of people ask us here, once they get started, where's that sweet spot of the percentage that I'm going to want to charge? Well, that could be anywhere really from 5% up to 8 or 9%. The reason there's that somewhat that big window right there, there's some other factors that you're going to learn when you go through and you do your practice analysis. If you've got a clinic that sees a lot of patients, but their money, like a chiropractor, let's say that a doctor like a chiropractor will see a lot of patients, but their average claim amount may not be $100. It may be $60 or $70. You may want to charge a little bit more than that. However, if you're working with a specialist, they're maybe charging 175 to 225. So you might want to be back down in that 6, 7, 8% range. So it just maybe lower it down a little bit, but you never want to go under 5%. You'll start losing money under 5%. So you just don't worry about it. Move on. You're going to find another doctor. All right. One doctor, 25 patients to see per day, open 5 days a week. You're going to charge 6% at $100. We're going to click on submit. Again, here's where the kind of money you can make with one doctor. So it's $39,000 a year. So remember that with your investment. See, ours is just under 30. And again, you're going to make at least $39,000 to $40,000 a year. Remember, I told you it could be up as high as 50, depending upon the type of doctor. It could be even more than that. And bring in about $3,250 per month. Okay, so we're going to look at some of these numbers here and how we came up with that. So again, if one doctor is seeing 25 patients a day, again, we're going to break this down. 100 patients times 25 is $2,500 per day that doctor is trying to make. So if you take that $2,500 times 6%, your average earnings, your earnings are going to be about $150 a day. Folks, I remember at one point in my life, I was happy to make $100 a day. And if I could make $100 a day, I knew that I was at least doing something. So here, it's about $150 a day. That's for less than 90 minutes of work a day. So imagine that you could add one more doctor to this. So just be thinking a little bit broader here, because you're going to see that you can go from a 6-figure income to possibly a 7-figure income by adding about 6 to 7 more doctors here. So that's where the money can really start to come into play. All right, so our average earnings, or your average earnings, are going to be $150 a day times 5 days per week. Again, that's $750 per week, 52 times a year. That's $39,000. So that's how we kind of did the math behind the scenes whenever we were looking at that earlier. So let's add 3 doctors. What does 3 doctors look like? Again, so let's add 3 doctors. Same numbers. The only number that we changed here was the number of doctors. So we changed that to 3. We're keeping 25 patients. We're keeping 5 days open, 5 days a week, 6% of $100. Okay, so we've got that. We're going to click on submit. Now look at what happens here. How quickly you go from a 5-figure income to a 6-figure income. You're going to make $117,000 a year servicing 3 doctors. So for those that are looking and trying to do your calculations already, you're kind of go, okay, that's a 6-figure income. What's that magic? Some people think that the 6-figure income is that magic number. And for most folks, that's nearly $10,000 a month in revenue. So that's a good paying job to do work and not have to drive, and you can stay home. And like today, I'm at home not having to wear a mask. You can just do everything that you're doing right from here, folks. So it keeps you right where you want to be, and that would be right in your home here, where it's safe and for you and your family, and making this kind of money. And then imagine that you could, at this point, you might say, I've been living in this one area. I might want to move out to the country now. As long as you've got internet service, make that move, because that's what you're going to do. So again, to think about what you would need to have here. So this is 3 doctors here. So what you would need is about 10 to 12 doctors to get to that 7-figure income. But first of all, let's kind of take a look at this again as a whole and show you what kind of money that you can make when you start adding some of the other services. So again, kind of just letting you know on time, I'm kind of watching the time. We've got about 10 more minutes here. And so in about 5 more minutes here, I'm going to kind of shift over. If you got some questions logged over here, I'm going to see what I can do to get through most of these. All right, so let's talk about adding some of the other services, because some of these other pieces you're going to want to utilize either in your marketing or in some of the support mechanisms. So I think Hassan asked earlier, what about those professional services? It's going to be some of these services that we have right here that can actually support those professional services. So one of them is called Quick Collect. So you're going to run into every doctor is going to have some trouble collecting. And the last thing a doctor wants to do is to send a patient to a collection agency. So let's stop doing that. Let's get them on the service of Quick Collect. The patient doesn't like to be sent to collections, especially if it's just for a $40 bill. And the reason I know that is that's actually happened to me. I've tried to keep up with my credit report, and boy, certainly if one doctor's office sends me to collections over a $40 bill that I'm supposedly owed them. And if I owe them, fine, but don't send me to collections over $40 and then end up ruining my credit. So you can see here where it can be kind of frustrating from the patient side. So introduce to the doctor Quick Collect, because Quick Collect has a 3 times higher return on getting that money, whether before it even goes to a collections agency. We've got that set up. And here, Quick Collect is just, imagine that happening to me. I may have gone to the doctor. There may have been a lab that my insurance didn't pay. And maybe the first letter that they sent me, I don't know if I got it or not. But again, Quick Collect would have just put me on a reminder letter saying, hey, Mr. Ogea, hey, I think you saw the doctor and you owe the doctor X amount. Oh, I get that now. Hey, let's get it paid. Can I call you? Can I get it paid over the over the phone? Sure. So that's why we said it's 3 times higher. So imagine, now this is where you're going to make the money. So if you get those 3 doctors, each with about 24 patients or 24 accounts per month, you are going to earn about $7.50 per month on each of those accounts. So that's $540 per month in residual income. So that's another $6,400 a year that you're going to be making from Quick Collect. So you can see that's a potential revenue from Quick Collect. Then you've got AutoCard. So this is a reminder from the doctor's office for their patients. So it could be for annual mammograms, for annual physicals, maybe for whatever birthday cards, whatever else. These are actually cards that get mailed out. These aren't e-cards. These aren't, something that comes in the email into their email account. This is an actual card that they get from their doctor, signed by their doctor, and this is sent out automatically. So imagine you're able to help those doctors. Let's say that they want to put about 200 patients each on those. Yeah, I've got some patients that I need to get in here for their annual wellness visits. Maybe we need to do some advanced care planning with some of my patients, or whatever it might be. It's just reminders. That'd be about 600 cards that were mailed per month. You're going to make about $1 a piece on those. So that's about another $600 a month that you're going to make. That's $7,200 more a year of potential revenue. Then we have iDocs Now. So for those that know about document cloud storage, this is what this is all about. Now, this is not an EMR. This is about all those charts that doctor has, one end to the other in their office. So why don't free up some of that real estate and let's get it all up in the cloud. So that's what iDocs is now. It's HIPAA compliant. It's actually searchable. So instead of the doctors having to pay someone to go out and find that chart and then get it and scan it to the patient or an insurance company, whatever else, it's all done here electronically. They actually get a login. They can go get what they need. It's time sensitive, so the time expiration will time out on it. Really cool things that are in there. Again, you get those same 3 doctors doing that. Again, that could add another $300 a month. That's another $3,600. You can see this is all kind of adding up here. Now, Audit Guard helps doctors protect themselves from audits. About every year, we see doctors under audits, whether it's from Medicare, whether it's from Blue Cross Blue Shield, whatever it may be from. Doctors could be under 2 or 3 audits at a time. What Audit Guard will do, it'll help those doctors find out before they're actually audited, fix and change whatever it might be. And that would be where the codes might need to be fixed, updated. You're helping the doctor. Maybe you really won't believe this, but there are some doctors that actually do what's called undercoding. So imagine that if you did an audit on those doctors and found out, doctor, hey, your notes that you're putting together here are really at the next level. So that's about another $40, $50 more that you can be making. But there are a lot of doctors that sometimes code too high. And so sometimes when they go through these audits, like with Medicare, Medicaid, or with Blue Cross Blue Shield, after they've done their audit, they may tell the doctor, hey, we paid you too much based upon your notes, so we want that money back. So doctors are always going through audits. So this is a great thing for them. So for this is how it works for you. 50 charts are reviewed per doctor, and you as a licensee, you're going to be making about $900 on each of those reviews. So imagine you have 3 doctors that do about 4 reviews a year. That's 12. Again, that's 900 times 12 a year. That's another $10,800 a year. Finally, we're going to end up with CodeWrite. I think this is one of the last ones. But CodeWrite here, I mean, this is so great. ABS has so many of these services that's going to just helps you build your business and get you on your feet. Because there's nothing that the doctor says, hey, can you do this? And you have to go, oh, man, I don't know if I do that. Every answer can be yes. All right, so with CodeWrite, again, this is where the doctor may ask you, hey, do you have coders on staff? Or are you a coder? You can say, I'm not a coder. I'm the owner of the business, but I have coders on staff. And with CodeWrite, you would be able to tell them, yes, I've got certified professional coders at my fingertips anytime. I can get you a 24-hour turnaround on any of your coding that you need. So if you're a surgeon and someone's dictating your notes and you need to get that turned around, get that to us. We're going to get that turned back around to you within 24 hours. Again, if you've got 3 doctors and you're doing 400 reviews on them, you're making about 50 cents per chart. Again, that's another $600 a month that you're going to be making. It's another $7,200 per year. You take all of that, plus you're doing the billing for the doctor. That alone can get you about $152,000 really or more per year based upon the specialty of the doctor. I'm telling you, we took the lowest of what we could get. with a primary care physician seeing about 25 patients a day at $100. I'm telling you, those numbers are so low. So what you're going to be making, you're probably more about $200,000 a year with about 3 doctors with what we're seeing right here. So again, at that point, if you're at $200,000 and you're wanting to really break that 7-figure income, then you're talking, let's see, 3, 6, 9. I mean, you're going to be there pretty doggone quickly when you've got doing billing from anywhere from 12 to 15 doctors. And a lot of our licensees are doing that. They actually do billing. We've got some that are doing billing for 20 to 50 doctors at a time. They're well in the 7-figure income range. So it doesn't take long to get there on a less than a $30,000 investment. That's what you got to do. Compared to your investment, what kind of money you could be making, even at under $30,000 investment to get a 6-figure income, it's a bargain when you start to do it. So, all right. So let me kind of start wrapping up here, and I'm going to get to your questions. So ABS is the only medical billing training company out there that actually offers you a 100% money-back guarantee. Now, how's that done, and how can we do that here? It's because Patrick Phillips, Adam Phillips, and the rest of the American business system truly believes in what we do and the success that we've had with our licensees. You're going to hear from one next week. You can ask them any questions that you're going to want to ask. And yes, that particular person went through training, had the opportunity to get her money back. She didn't. Now she's very successful. She's going to share her story with you next week. However, there have been some people that have gone through our training and goes, you know what? I've heard everything you said on all the free webinars. I've got you gone through your training, and it's still might not be for me. That's where you say, I think I just want my money back. And without any questions asked at that point, we make the arrangements to get all the equipment, everything back from you, all the marketing materials, everything that we send out, and take care of it. Because we want you to be a happy customer, whether you're working with us or you're not. We just want you to be a happy individual with us here. So that's why we do what we do. If you get any more questions about that, just work with the person that you're kind of working with. We do have our training online. We used to do it at a hotel about every 6 weeks apart. We used to love to do that. But even before COVID, we already kind of knew that we really needed to start shifting to an online training support service. And we were doing that back in October, almost a year ago now. We've been doing it for nearly about a year. Then obviously when COVID broke out, we didn't have to do anything differently. So we were very grateful that we kind of took that plunge way before we even knew that we really needed it. And now we're getting people routed in there. So as soon as you complete all your paperwork, man, we can get you started within the next 2 to 3 days. You just got to get on that schedule. And you might be wrapped up with your training within the next couple of weeks, not having to wait for the next training, which could be another 6 weeks away. So you're going to really like how we do our training here. All right, so let me tell you what your next steps are, because I know we're at the top of the hour. Some of you got to get going. I understand that. I was kind of long-winded down some things, but I wanted to make sure that you get all the information that we know that we can give you during these webinars. So what's your next step? Well, there's about 5 things you can do. First of all, we've got an entire research guide. It's in a PDF format. Again, just ask the individual that you're working with here at American Business Systems to get that over to you. It's downloadable. You can print it out. You can do some research on it. Folks, I'm going to tell you one of the best services that you have to do some of your research is our YouTube channel. So go to youtube.com/YABS. Go see literally the thousands of videos that Patrick and I have done. Patrick's done by himself. He's interviewed people. We've done demonstrations out there. We've got so much material out there that you go just get lost out there and go find it. But you need to go look at some of those, especially some of the ones that have been done within the last 2 to 3 months, because obviously that has the most recent information of some of the things you're going to need to know. On top of that, we'd love for you to work with and talk with our current owners of American Business System who are medical billing companies. This is a one-on-one with you and them. We're not on the call. They're not recording the call, sending it over to us. And this is a simple call that you make with them. So this is where we pull back the curtains. They're going to tell you the good, the bad, and the ugly. But they're going to tell you why they stuck it out and what kind of things that they've done. And 100% of them are probably going to tell you, whatever you do what ABS tells you to do, because a lot of them will say, gosh, I thought I could do it a little differently, but all it did was push me behind. And I just went back and did what ABS told me to do, and it got me right back on track. So please get that reference list and make some of those calls. Schedule those. Those are important for you. And those other licensees out there would just love to be able to talk with you, because remember, they were sitting in the same seat that you're sitting in right now. Fourth, ask for a live demo. If you haven't jumped in and drove this thing with one of our ABS business coaches here that we have here, business reps, I can't remember what we call each other anymore, but the people that you're working with here, they would love to be able to do a demo with you of the iClaim EMRX platform. And then finally, get a copy of the purchase agreement. Look at it. You'll read through it. You're going to find out, yep, that guarantee is right there on the front page. So you can't miss out on that. And then follow those instructions. Get your money together, and we would get you signed up and get you going on here. All right.